Whether you are receiving a surgical aortic valve replacement, also known as SAVR, or open heart surgery, or undergoing transcatheter aortic valve replacement, or TAVR, take the week before your procedure to prepare. As a first step, familiarize yourself with what will happen the day of your procedure. Regardless of which treatment you're receiving, your care team will share the procedure process with you, including what to expect during recovery. The visit before your procedure could take 1 to 2 hours or more, depending on if you're receiving SAVR or TAVR. Typically, since TAVR is a minimally invasive procedure, the preoperative appointment will be 1 or 2 hours. The SAVR preoperative appointment could be longer. During this visit, you'll complete paperwork, blood work, and other evaluations, including EKG and chest X-ray. They will give you detailed instructions and explain how to prepare for your procedure. This is also a good time to ask questions about daily activities and possible modifications during your recovery. Finally, you'll receive all logistical information for the day of the procedure. If you have any questions, do not hesitate to reach out to your care team. Now that you know what to expect on procedure day, you're another step closer to being ready for your heart valve procedure. On the day of your procedure, you'll check in and be prepped by your care team. While the specific details may vary, you can anticipate the actual procedure to take approximately 1 to 2 hours for TAVR and 2 to 4 hours for SAVR. Afterwards, you'll be taken to a recovery area and your team will let your family or caregivers know how soon they can see you. Now it's time to learn about what recovery could look like. This will be different for every patient based on your unique condition and risk factors, but most patients say they start feeling better right away. In fact, most patients who undergo TAVR are up and walking within a few hours of their procedure. Patients who undergo SAVR will experience a longer recovery process from the open heart surgery. TAVR patients can spend an average of 1 to 2 days in the hospital, and SAVR patients can spend up to 5 to 7 days. Once your care team says you're ready to go home, they'll explain any medications you may need to take, activities you can do or should avoid, and when you'll see your doctor again. You may also be enrolled in a cardiac rehab program. It'll be helpful information as you return to your daily activities. Now that you're prepared going into your procedure day, you're ready for the next stop in your AS journey: recovery and getting back to active living. Visit myinteractiveasjourney.com to learn more and access additional resources.